What's Up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for February 5, 2021, Vaccine Week Finale. Q&A with Dr. Josh Sharfstein. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, the producer of Public Health on Call. Thank you for joining us for Vaccine Week on the podcast. We'll have another week of special content lined up starting February 8th, where we'll be focusing on schools and education. You won't want to miss it. Today, for our Friday Q&A, Stephanie Desmond asks co-host Dr. Josh Sharfstein, who has worked in the past at the state of Maryland's Health Department and the U.S. Food and Drug Administration, to answer a whole bunch of listener questions about the COVID-19 vaccines. Let's listen.
Josh Sharfstein, thanks so much for being with me.
Thanks for having me again, Stephanie.
So today we are going to go through a bunch of listener questions about the vaccine. And we are getting lots and lots of questions. It's really on everybody's mind right now. So I guess the number one question I have here is, how do I find out where to get vaccinated?
Well, the first thing is whether you're eligible, and that varies based on where you are, based on what the particular guidelines in your area are. So it's good to check with your local health department, starting maybe by going to their website or go to the state health department's website to find out. If you are eligible, unfortunately, that doesn't necessarily mean that there's a dose with your name on it, because there's not enough doses to go around even for people who are eligible. The best thing to do is to talk to your doctor, as well as check with the local health department to see what the process is for finding and getting signed up for vaccination.
Mm-hmm. And a lot of this is really, catch as catch can, it feels. So, I mean, for example, I was able to help get my mother-in-law a vaccine, and now it was in the next county, and now they've said that they're only going to vaccinate people in the county. So you really have to, once you even get an appointment, you have to follow up.
I think that's kind of unfortunate, just the fact that to a certain extent in some places it's turned into a hunt for vaccine as opposed to an orderly process that is fair. Hopefully over time that'll sort out.
Mm-hmm. So here's another one. We hear a lot about how the second dose of this 2-dose regimen needs to be given either 3 or 4 weeks after the first dose. Can that be delayed a bit? And what's the maximum delay?
So the CDC recently put out a statement saying ideally you'd give it right when the day arrives for the second dose. But if that's not possible, you can wait up to 6 weeks after the first dose.
Is it okay to take Tylenol or other medication to help with the side effects from the COVID vaccine?
Yes. In fact, some people take Tylenol or ibuprofen before they get a vaccine, just to kind of have that ready to go and to prevent, pain or fever. I don't know that there are any studies to show how well that works, but certainly it's fine to do that in the recommended doses if symptoms develop.
Mm-hmm. So we're hearing a lot about new variants of the virus that appear to be more infectious than the ones that have currently been circulating. And the first question I have here is, if I've gotten the COVID vaccine, can I be infected by one of the new variants?
Well, the COVID vaccine is not perfect protection from getting infected, right? Even if it's 95% effective for getting COVID, it's not 100% effective. So you can get infected by anything. So you can get infected by the new variants too. The question that people are wondering is whether those variants actually behave differently than the coronavirus that the vaccine was studied with, that maybe it's not 95% effective, maybe it's less for some of the new variants. We don't know that for sure. There's some concern about some of the variants that they may be less susceptible to protection from the vaccine. And that's why the companies are thinking about doing booster shots with different variants in them looking forward. But right now, it looks like the vaccine causes protection, generates protection for the virus that's out there, and it is really important to get vaccinated. And it's likely, though, over time that we'll learn more about these variants and whether our vaccination strategy has to shift to account for them.
Mm-hmm. If I'm at the end of the line, which I actually am, does this mean that it's possible that the vaccine will be less effective by the time it gets to me because of these variants?
It's possible, but it's also possible that the vaccine will have already adapted, that they'll have swapped out the strain for one of the other ones. I think it's hard to say. In general, it's hard for a virus to evade a vaccine. That generally doesn't happen. The obvious example is flu, where it does happen, but flu has some unique properties. So it may be that it's not really a question of totally evading the vaccine, but maybe being a little bit less effective, and a little bit of tweak to the vaccine can help account for that. We're just going to have to see how this story plays out.
Mm-hmm. So here's another one. Can I get the COVID vaccine if I currently have COVID?
If you currently have a COVID, we want you to get cared for your COVID. I think that's the most important thing. And then when you get better from that, I think it is reasonable to be considered for vaccination.
So stay home and don't infect everybody else at the COVID vaccination center.
Absolutely. They'll ask whether you have COVID, and they don't want to let people in who have COVID, I think, because they don't want to be given to the other people, because other people online who haven't gotten the vaccine and haven't had COVID are quite susceptible.
Right. Especially, I know that there a lot of places are giving them in sort of indoor arenas or indoor recreation centers because it's wintertime. So
right, everyone is going to be masked, but it's still better not to have somebody with known COVID in the midst.
So I have this question. Within a household, what happens if one person gets vaccinated and the others do not? Or if most people get vaccinated, but the one person can't? I guess the idea there is, does my vaccine protect you if you're not vaccinated?
So the studies were done to show that people who get vaccinated are much less likely to get sick from COVID. The data on how much less likely they are to get even infected with COVID, even if they don't show symptoms, we don't really know yet. It hasn't been fully presented. It looks like there is some protection, but how much? We don't know. So I think you have to assume that other people in the household who haven't been vaccinated are still very much at risk for COVID, and you have to continue standard precautions.
Mm-hmm. If you had COVID and you lost your sense of taste and smell, will getting the vaccination resolve that?
I don't think so, no. The vaccine is really to train your immune system to recognize the virus so that the immune system kills it as quickly as possible before you get sick, but it doesn't address the damage that COVID may have done to your body previously.
Mm-hmm. And another listener question, sort of in the same vein, if you're a COVID long hauler, so that's someone who's had some symptoms of COVID for a long period of time after the virus seems to have gone, will the vaccine alleviate your symptoms?
I think that also is pretty unlikely, again, because those symptoms are probably related from damage that the infection itself did, whereas the purpose of the vaccine is to train the immune system to prevent another infection.
Mm-hmm. Here's one. If an indoor gathering or event is limited exclusively to people who have received 2 doses of the vaccine, is it safe without wearing masks?
Well, I think at this point, as we think about the social bubbles that we live in, that if people are vaccinated and they have other people in their bubble who are vaccinated, I think the risk is going to be much less in that interaction. I think we just don't have enough people vaccinated to say, like, let's, have a huge concert and see what happens. It's possible, though, as we look into the future, as we understand more about transmission of the virus among people who are vaccinated, that we will see scenarios where people who are vaccinated are going to be able to participate in certain activities that they otherwise couldn't.
Do those raise equity questions?
It is certainly an equity question in the sense of some people may get to do things and other people may not get to do things. But the question is whether there's a legitimate basis for that protects people's health. So, I do think that this is an area that people have to really think through. But it wouldn't surprise me that, for example, for certain types of events that either vaccine or some other proof of immunity may be part of the story as we look ahead in order to protect people.
Mm-hmm. Could you see that happening sort of like on airplanes or things like that?
It's possible. I think that may be, even a little bit further out in discussion, but
yeah,
we know that there are employers that are thinking of requiring vaccination. We know that that there are scenarios where, frankly, it is not safe right now to be without being protected. So it's going to be, I think, a increasing subject of conversation.
Mm-hmm. Here's another one. I am on immunosuppressant medication for an autoimmune disease. Will I have to stop taking my medication to be vaccinated?
So there are a lot of immunosuppressant medications and a lot of autoimmune diseases. So I think this is a good one to talk over with your doctor in that case. But most likely, I think in many cases, the answer will be no. You don't have to stop. But I think it's worth talking to your doctor about that.
And here's one more. If I get the COVID-19 vaccine, will it affect the results of a rapid COVID-19 test taken the following week?
It will not. The vaccine shouldn't overlap, I think, with the test as far as I'm aware.
Mm-hmm. And I have a question now for you. We've gone through the listener questions, and I guess my question for you is, what questions do you still have about the COVID vaccine?
Well, I think one of the big ones is how long immunity lasts, whether, we'll need to get booster shots or at what point. I think that's probably the biggest question. And I also have questions about the supply. When will we have enough for everybody who's eligible even now and eventually be able to expand vaccination? And then I have questions about how we're going to reach people who may not be, jumping at the chance to get the vaccine right now, who may have trouble signing up online, who may not want to go to, a major armory with the National Guard and stand in line to get vaccinated. It's just not something they feel like doing. But nonetheless, they are really at risk for COVID. How do we reach people like that? Because they're people who need the vaccine. And it's really important to find them and answer their questions and help them get comfortable and vaccinate them.
Great. Well, Josh Sharfstein, thank you so much for joining me.
Thanks for having me, Stephanie. Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.